Let's be real. The path to psychology can feel like a toll road with a hefty price tag, especially for folks of color, where systemic obstacles can make scholarships, financial aid, and training feel like a distant dream. But hey, the good news is there's a whole community out there who wants to see you succeed. We're talking about therapists who get your background, researchers tackling cultural competency heads on, and all of them working to bridge the mental health gap. So, where can you find these resources besides the usual suspects? Well, today we're shining a light on the amazing Access Psychology Foundation, a group dedicated to leveling the playing field in mental health care. We'll be diving into the resources they offer to help you reach your full potential. Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Tsen. Today we have two guests. Dr. Lada McGinn is a clinical psychologist, co-founder and co-director of Cognitive and Behavioral Consultants, an evidence-based clinical and training center. She is also a professor of psychology at the Furkhoff Graduate School of Psychology at Yeshiva University and director of the Cognitive and Behavioral Therapies Training Program for Anxiety Disorders, OCD, Trauma, and Depression. Her expertise has been highlighted by various media outlets, including Elite Day, The Huffington Post, The New York Times, Parents, and Women's Health. Additionally, Dr. McGinn is Vice President of the Access Psychology Foundation, which she co-founded in the year 2021. We are also joined by Damien Travier, the Executive Director of the Access Psychology Foundation. And prior to his work with the foundation, Damien served as Vice President of Programs at the Jackie Robinson Foundation and as Director of Leadership Development at Prep for Prep, Inc. Earlier in his career, Damien served on the management teams of the Thurgood Marshall College Fund and the New York City Partnership in Manhattan. Damien has been board member of numerous organizations and partnerships, including the White House Initiative on HBCUs and the Syracuse University Mentor-Mentee Association. So today, both Dr. McGinn and Damien will be discussing with us unique ways in which the Access Psychology Foundation aims to increase the research and training of CBT across race and cultures, diversity in our psychology workforce, and ways to offer low-cost CBT to historically underserved populations. Damien and Dr. McGinn, thank you for joining us and welcome.
Jack, thank you for having us.
Hi, Jack. Thank you for calling us. Please call me Lada.
Oh, okay. All right. Well, why don't y'all just tell me a little bit more about the foundation, because it was founded in 2021, and I know that a lot of folks would be excited to hear about the resources and offerings that y'all have.
All right. Well, maybe I can get started telling you how we thought about it, and Damien can take over and tell you how it was born. Well, Alec and I, that is my co-founder with me, we've been doing work in underserved communities for a while now. And this was a unique opportunity, though, to provide what we really care about, which is disseminating evidence-based care. And so, this has been something we've been thinking about for a while, but when COVID hit, we knew that the needs were just going to arise before the mental health tsunami was pronounced. We had a sense that this was coming. And so we decided to create this foundation so that we could help people of communities that were underserved. And maybe Damien can tell you a little bit about the foundation and what it does and all the programs.
Yeah, Lada, thank you. As Lada suggested, she and Alex started the foundation in 2021, given the conditions that were happening in this country with respect to young people and adolescents, and the incredible and effective evidence-based approach by which they help support young people through those crises. And obviously, the urgency was increased after the pandemic. At the Access Psychology Foundation, we approach it, I believe, the issue of equity in mental health care from a very holistic perspective. We do mental health treatment and training, and we do that through 5 distinct programs, Jack. We have an individual therapy program. We provide scholarship support to individuals who cannot afford individual counseling. We could provide up to 90% of the cost of therapy. This is evidence-based CBT and DBT therapy for these individuals. We have a school training program by which we support the staff and leadership of schools and community organizations that work in diverse communities. So Lada and her team on the CBT team will go into a school or community organization and train their staff in evidence-based CBT or DBT. That will help the staff better support their community, whether it's their students or students in their after-school program or community group, whatever it may be. In addition to that, we have a program by which we like to support emerging clinicians of color that we know will go back into the community and support access and equity in mental health care. We have a scholarship for postdoctoral fellows, graduate level interns, and graduate level externs to have a year-long training experience, and we provide a $15,000 grant to support their journey in that year of training. We also have a scholarship for existing clinicians that work in diverse communities. Clinicians these days, as we all know, I'm sure many of the folks listening to this podcast know that you have to maintain your licensure by getting continuing education credits or unions. And sometimes it can be expensive for maybe folks that work with low-income clients or maybe are new clinicians, or maybe they want just new training and understand the efficacy of evidence-based CBT, and they want to get a workshop on that topic. And we provide a scholarship for individuals to receive that training for very low cost. And the last program that I'll mention, I think is one of our most important, is to support young people who want to make a difference in the mental health landscape. We have a summer internship and a year-long internship for high school students and for undergraduate college students. So these are young people who can come and spend a year with us or a summer with us and shadow clinicians that work with LADA at CBC, can participate in training sessions, can do research, and really understand the work of what it's like to be a professional mental health practitioner. So we'd like to say that, with Lada and Alex, really great intuition, we're attacking this issue of equity from a holistic perspective.
Yeah, wow, that's amazing, because we hear oftentimes, with programs and support that it's just maybe at the graduate level, but you're really highlighting this from a pipeline as early as high school. And I think that is a tremendous boost. In fact, you look at cost, to get a doctoral program, it's phenomenal that you're starting early on, and to introduce the concept of psychology. As someone, myself, AAPI Asian, we don't really talk about mental health issues early on. So to have that conversation at the high school level is phenomenal.
No, I was just going to say, I think that was one of the things that was really brilliant about Lada and Alex's idea from the get-go, was that there is a through line through all of this that can start very, very early on. And we like to say at APF that wherever you are on your mental health journey, whether you're looking for support, whether you want to support the system, whether you want to be a practitioner and give healthcare, we can support you wherever you are on that journey. And I think there are a lot of things that happen to individuals, young people who maybe want to become psychologists or want to become social workers or want to be in this mental health space, but there are different roadblocks that happen throughout the course of their academic journey. A lot of times those roadblocks are financial. We want to make sure that there's somebody there to support them to help smooth over some of those bumps when those financial circumstances arise.
And Lada, this question is probably geared more towards you. Can you tell me more about the training? And we know, CBT is evidence-based. The part that I think I like to hear more from you is, how do we adapt or incorporate the idea of diversity and, culturally informed practice as part of, say, the CBT training that you're doing? And so can you tell me more in detail what all that is involved?
Yeah. So in the last year, for example, the last year and a half, actually, CBC, which is the company that Alec and I founded as well, has been having a speaker come in to train us on what we now call culturally responsive care, right? So the idea is that you are, to not only becoming aware of your bias, but learning how to adapt what you do to the person in front of you. And so this has been a big journey, and I think we'll be continuing to do that. But I think over the years, there's been several. I think the field started with the Dr. and Dr. Sue from California, and they sort of kicked off the field of diversity in psychology. And there's a lot written on it now. And I think we've transitioned from thinking we're going to become culturally competent to being having cultural humility, to now looking at it as providing culturally responsive care. How not to dismantle what you have that is evidence-based, but how to adapt it. So there's more and more research now on adaptations of CBT all across the world. In my other hat that I have, I'm the president of the World Confederation of CBT, which is an organization of organizations, and that has organizations all over the world. So I think I've had the privilege of seeing a lot of research and practice being implemented across the world. And I think we're learning a lot from the different cultures, and even learning how to reach them. So for example, I know that some work being done in Africa by the World Health Organization, and that is sort of training peers and training grandmothers and how to sort of bring people into the treatment. So it's also learning how to go to a culture that doesn't have mental health in the foreground and how to bring them into this journey of mental health. And I think on this side, advocacy researchers are trying to adapt manuals to be responsive. And I think it's an evolution, and it's a continuing journey.
Yeah, it's definitely an evolution because you're collecting field research data, feedback from the participants, as well as the clinicians who are delivering the interventions.
Yeah.
But now, out of curiosity, what have you seen has come up in terms of some of the adaptations here in the States?
I think it varies by condition. I know that the trauma treatments, PTSD in particular, there are fewer adaptations because the core of it is essential for every treatment. Like prolonged exposure, for example, is a very significantly sort of studied treatment. And they've seen that without that, the treatment doesn't work. So there's a core that just has to be there, and the adaptations have more to do with sort of reaching the person and validating their unique experiences. So that's an example of where the treatment has to be fairly adherent. And I think the other has to do with, how people describe symptoms, for example. And in the Asian culture, a lot of times people will talk about physical symptoms of illness and how to help translate that and how to help understand their wording to describe the concepts of CBT.
Well, I don't know if you want to say a few words about that. That's another adaptation, I think, that we're seeing here in the States, how we're working with the school system to do some of this work.
Well, thank you for reminding me of that, Damien. I appreciate that. So I think that's an example of a curriculum that's very evidence-based, that was created, and then in partnership with the teachers who were about to implement it. It was a journey to sort of take their sort of lived experience to sort of transform that into a material that was adherent for that population, if you will, right? So these teachers are teaching some of the poorest students, and they have been living in that community for a long time. And so having that partnership, and I think, like, as an example of even sort of rewinding before that, even before I developed it, I'd done a qualitative study on looking to see what the barriers are from their perspective and what proposed solutions there are. So it was sort of built with those barriers and solutions in mind. And then when I finally created it, then I worked with the teachers to then see how the material then landed with them. So then it was a consultation session each week that would require not me teaching them, but then them teaching me as well. So I think it was a great partnership to create a very rich product that then, takes the principles of both worlds into account.
Well, fantastic. That's such a great illustration of this pursuit of cultural humility as also cultural adapting our interventions so that it fits the community, because that's who we're trying to serve here.
Yeah,
That's right.
So, I mean, this is a lot of work, and both of y'all are really at the height of your career. So how did y'all get here? Like, what's keeping y'all going?
I think it's good to have passion for what you do. And I think in addition, you need a dose of hard work, willing to work hard, that I think makes all the difference. I think knowing that we're making a difference in the world is something that keeps me going, for sure. That we're changing the world and we're making the world a better place. As cliched as that might sound, that's our mission. We really want to make it, our vision is to create a future where there is this sort of equitable access to treatments that work, and that it's a reality for all communities.
Yeah,
Damien, how about you?
yeah, no, thank you for that question. I think for me, I'm not a mental health professional. I'm a nonprofit executive, if you will, but I'm somebody who has grown up my entire life fighting for equity in its various forms. When you read a bit about my bio earlier, Jack, you mentioned the Jackie Robinson Foundation and Thurgood Marshall College Fund. These are organizations that try to advance equity through education. And when I got the call from Lada and Alec a few years ago to consider this opportunity to advance equity in mental health care, it was something that I really wanted to try to take advantage of. I know firsthand through my own family experiences, my mother struggling with mental health issues and being seen really all my teenage years and through my adult life, and understanding that dynamic, understanding how important it was with the students that I supported in the education space when I was in that, and how they had to deal with and navigate their mental health issues, things like imposter syndrome and anxiety and things of that nature. When Lada gave me this opportunity to be able to fight this fight from inside, realizing that it was really a through line through all the different challenges that a lot of us go through, whether it's familial issues or things in education, or just your own personal anxiety. It was an opportunity for me to, I think, to hit a target around equity that can have a really, really important impact on communities of color. One of the things that is, I think there's no secret, is that it's been difficult for communities of color to have conversations around mental health over the years. There's been a stigma. I can speak from the African American community's perspective. There's been a stigma to even talk about mental health issues, and we would try to address them by speaking to your preacher or your reverend, or talking to your auntie or a sister, and really not being able to address it in ways that have been proven effective through the work that folks like Lada do. So that for the chance for me to be able to advance equity and make a difference and close that equity gap between the haves and have-nots in this country, Access Psychology Foundation allows me to do that. And yeah, I'm excited to do it every day.
So, a question I ask all my guests, Lada, can you tell me about some of the challenges you faced as a person of color and how you overcame that?
I would say that I was born in India. I'm from India, from Bombay, India, and my parents are from the north of India. So I came here when I was 21. My early career was very challenging. It was hard for me to say whether it was because I was a person of color, or because I was a woman, or because I was young, I was an immigrant. So it's hard for me to parse that out. But I certainly did experience sexual harassment from a supervisor. And I was given, very few opportunities and was paid less as a woman in my early years. But again, I try to think about where that came from. But I would say that over the course of my career, if I think of it from the start, I would say in general, America has been good to me, And I grew up in India where I was the majority. I think my sense of self was formed there. So I had that core when I came here. And I think that really helped me, I think. But I remember, the sense of shock I came here when I realized that I knew so much about Americans, but they really didn't know anything about India. They would be taken aback when I shared I was from India, and it seemed to me at the time that Americans didn't know much about Indians. And for example, they seemed very surprised that I knew English. And there were people, of course, that were open and curious about India. And then there were people who just had negative reactions about India. And, I think that I obviously have adapted to the American way of life, but I didn't have sort of personal experiences with it. But I remember when I came here that I came to DC and then I moved to New York. And I heard about this group in New Jersey called the Dot Busters, and they would attack Indian women who were wearing a tika on their forehead, and which was terrifying to me. So I didn't personally experience it, but certainly it was sort of harrowing to think about that. And, the view of Indians, I think, in America has changed drastically from the time I came here to now. It's almost unrecognizable. So racism exists today for sure. But when I think about what it was like back when I came here many, many years ago, it has improved. So that gives me hope and optimism for sure.
Yeah. And so for you, Lada, what does it mean to be an Indian American psychologist?
I would say that my Indian heritage and identity is very important to me as a person, as a psychologist. I'm not religious, but I am a Hindu, and I appreciate Hinduism. I appreciate Buddhism above all, and it has influenced my work. I also appreciate the Indian culture, the people, the food, the music, the family ties, the deep respect for elders. I think that will always be imprinted on me. And I think, what's interesting is I mentioned earlier that I grew up as a majority in my country. It didn't occur to me that I was an Indian person until I came here. Like I was just a person, And when I came here, I was like, oh, I'm from India. Like that's who I am, And I think that's a very different experience. So I think that I'm certainly proud of the way that I've contributed to paving the way for Indians to consider psychology as a viable field and occupation. When I entered, I didn't know any Indian that went into psychology. So I think I've been fortunate to be able to contribute to the development of disseminating evidence-based mental health in India. So I founded the CBT organization in India. I helped found it. So it makes me very happy to see so many Indians coming into the field today.
And so, Damien, with you, in your career as a person of color, what were some challenges that you faced and overcame that you would be willing to share?
Yeah, I think, there are a lot of things that come up. I grew up poor, single family in New York, and my mother was a hardworking, tough cookie who was very strict and disciplined and, begged, borrowed. And so I was able to go to private school. I think that was really the foundation of who I've become as an adult, was going through that experience as a young person, being bussed out of my projects called the Martin Luther King Jr. Housing Projects is where I lived. And I was bused to a LaSalle Institute, which was a private military school. And I was one of two Black kids in the school. And I saw very quickly the difference between the haves and the have-nots. They were being dropped off in their Audis and their parents were able to be at all the games. My mother had to work. And, after school events, I took the city bus home and saw the kids, get into their nice cars and go home with their families. So I sort of committed from that moment on to be a part of closing the opportunity gap in this country. My experience there allowed me to go to a great college and get a graduate degree, of course, as well, and become leadership in the organizations that I've been a part of. Well, one of the things that you really can't escape as a person of color many times in this country is this imposter syndrome that you feel quite often when you're in these spaces where you may be the only person of color. And there's been many times when I've been, I don't know if the word is blessed, but been the only person of color in a room and had a seat at the table, so to speak. And you go through these emotions of, imposter syndrome, of, am I being accepted in this community or am I Black enough in my other community? So there are all these things that you deal with as a professional of color. It's only, through therapy and hard work and a great network and great mentors like Lada, I've been able to sort of, work through those things. But I will continue to support emerging professionals of color because I know that they certainly go through some of the things that I went through, and let them know that there is truly, truly good things on the other side of those thoughts.
Yeah. Both of y'all, phenomenal experience, very touching. And I love that there is allyship in what y'all are doing, what APF is doing.
Yeah. Absolutely. Absolutely. Yeah. I think one of the beautiful things about what we're doing is we're not just supporting the African American community or just supporting the Hispanic community or the Asian community. We are really supporting marginalized populations. We've supported rural LGBTQ practitioners. We've been in Flint, Michigan, working with their community organizations. We are now in talks right now with a practitioner in Alaska who works with Alaska Native population. So I think that's one of the beautiful things that you see, an Indian American professional, African American professional working together to support uplifting all of our communities.
Is there anything else you like our listeners to know?
I would like them to visit our website. The Access Psychology Foundation is a new and growing organization. We have already had some incredible impact in the community. We've worked with organizations in the greater tri-state area, like the Boys and Girls Club, Northern Westchester, school district like the Ossining Union Free School District, high schools and like Esperanza Prep Academy and Mott Hall High School through the great work with LADA. We've supported scores of individuals through their individual mental health journeys. We've supported a number of emerging clinicians from schools all around the country, NYU and Columbia and St. John's and Georgia State University and Florida State University, to just name a few. We are beginning to partner with agencies and organizations around the country. I would like our listeners to know that we are here fighting the good fight, and we could use their support, both in just championing the work that we do, but also their financial support. We're a nonprofit, so we're always trying to raise money. Every dollar that comes into our organization goes right back into the community to have the impact that we like to have. So learn more about APF. You can visit us at access-psychology, www.access-psychology.org, and learn more about the great work that we do.
And Lada, is there anything else you'd like to add?
Well, I think that the pipeline issue that Damien touched on before is a really important part of what we do. So that is that we are making a difference right at the people's needs today, and we are building this sort of workforce for the future. And I think that is where the difference is, because you are not only providing treatment, providing resources for people who need therapy today, but how do you scale that to a public health impact, right? So by training the staff at schools, we are then reaching thousands of students in that school. By training mental health professionals, we're getting help for all their patients. And then by getting young people into the field, we're increasing the provider workforce. So I think it's a unique organization from that perspective, that we are trying to sort of hit every part of the workforce and the problem.
Thank you both very much for your time. Any final thoughts?
I want to thank you, Jack, for giving us this platform and the great work that you do, just telling the story of psychology and the people of color in psychology to the world. So thank you for your hard work and giving Lada and I this platform today.
Yeah, for sure. I think that what I'll say, in addition to thanking you, is the fact that you are even having a topic like this out there, right? So there's a mental health tsunami out there. And I know that in the recent survey that I read, 3 out of 4 American adults, report that they're struggling with mental health in some form or the other over the past 12 months. And that makes that sort of having a discourse about mental health so important. And there is a dearth of people, sadly, that are trained in evidence-based treatments. I mean, it's hard enough to get a mental health provider who's evidence-based if you have the means. But if you don't have the means and you are a person of color, the challenges are extreme. So I think, just by donating and supporting APF, that mission, our mission, I think you are making a difference. And you can donate money to enable APF to fulfill its mission. You can refer people of color to APF who would like to get scholarships to get trained in evidence-based practice. You could refer consumers who need treatment but cannot afford it. And then you also can join APF in really creating awareness and reducing stigma related to mental health, in communities of color.
Well, definitely phenomenal work and amazing resource. Thank you so much for your time.
All right. Well, thank you, Jack. Thank you for having us.
Thank you, Jack.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.